Okay, so if you could put your Dr. Adebayo, if you could put your headphones on. Thank you. I'll turn the volume down here.
Put it right.
No, that's just
I
come
know,
on,
I know,
guys.
I know. I'm going to put it. Okay, put it
You're
right.
taking
Put
a
it like this.
while. I cannot keep the
It's
music
okay. It's
bed
okay. It's
going.
okay. It's okay.
Yeah, I love how you say it's okay, but I had to get up to do it. Are we live? Next time, let me know. Studio. Smooth 98.1. It is 18 minutes gone past 5 o'clock, and it is more than time for us to have smooth health here on the Smooth Drive with Sope Martins. And today we are going to be talking about heart failure. I did say we need to start talking about heart health, and I'm looking forward to this conversation so much. And with me for this conversation, I have got Dr. Adebayo. He is a graduate of the University of Ibadan, completed his residency program at the University College Hospital Ibadan, and qualified as a fellow of the West African College of Physicians. Oh, the list is long, Dr. Adebayo. But most importantly, for today's conversation, he's a consultant cardiologist and director of medicine at Iwosan Lagoon Hospitals. So, welcome to Smooth Health.
Thank you.
It's so great to have you on the show.
It's a pleasure to be.
And I'm really looking forward to this conversation. So, the first thing I will ask, first things first, what is heart failure and what can cause it?
Yes, when the heart becomes unable to pump blood sufficient to meet the metabolic needs of the body, then that heart has failed. That's what it's called heart failure.
Okay.
As to the causes, there are many causes. In fact, heart failure is described as a common end pathway of any condition at all that may affect the heart. But I would come down on some conditions that are common here
Okay.
so that we will know about them. Of course, top on that list is hypertension. Hypertension just refers to sustained elevation of the blood pressure and is very common in our environment. The data shows that about 1/3 of every adult in Nigeria is hypertensive. And usually when you do not detect the blood pressure on time, or you do not treat, or the treatment is inadequate, eventually that may lead to heart failure. Another important cause are heart muscle dysfunction, maybe inherited, maybe acquired, what we call cardiomyopathies. Yes, that's also fairly common. And then, of course, valvular abnormalities. The valves are actually like windows of the heart that allows blood to flow from one chamber to the other and then to the rest of the body. If they are dysfunctional, either they are thickened, narrowed, or incompetent, then of course that we can eventually lead to heart failure.
Whoa, doctor. So you said thickened, narrowed. I understand those ones. What do incompetent valves look like?
All it means is not able to do what it's supposed to do. The valve is supposed to allow blood to flow out and then close so that it does not flow back.
Okay.
So it's supposed to be a one-way traffic. But then when it doesn't close properly, so part of the blood that's gone forward then comes back again.
So for people who grew up with siblings, that's called backwash. That's what we're talking about, right? Some goes back in.
Okay.
All right. And so what kind of symptoms would denote heart failure? Because when we watch the movies, usually somebody clutches their chest and then they say, "Oh, it was a heart attack." But what would we see in real, actual life? What would we see as symptoms of an indication of heart failure, or at least worsening heart failure?
Okay, so it's important to distinguish some terminologies. Of course, if somebody clutches the chest and complains of pain, that would be a heart attack, not a suspected heart attack, not a heart failure. So, heart attack occurs when there is a narrowing or a complete shutdown of blood supply to the heart. Because the heart pumps blood to the rest of the body, but it also gives itself part of that blood through some narrow pipes that supply the heart. So if they are narrowed, critically narrowed, or complete shutdown of those vessels, then heart attack occurs.
Okay.
Heart attack may lead to heart failure. It's one of the possible causes, but not necessarily, it's not the same thing.
Okay.
Because heart attack may lead to irregular heartbeats, it may lead to death, it may lead to so many things. But one of the things that heart attack may cause is heart failure. So the symptoms of heart failure itself, when you talk about a de novo heart failure, um, more easy to recognize is what we call shortness of breath.
Okay.
So you find that somebody is able to walk, ordinarily walks a kilometer, and then he discovers that he's only able to walk about three-quarter of that. He gets short of breath when he attempts to go beyond that. I mean, he needs to rest
Mm-hmm.
before he's able to continue. And usually without treatment, this is progressive. What it means is that he then finds that he's able to do just half a kilometer,
And then a
then a
quarter.
quarter, and then he's only able to move within the house. And then sometimes even at rest, he then gets short of breath.
Oh, wow.
But that's a more advanced. And unfortunately, that's where most people will come to the hospital. The other important symptoms would be if you're having shortness of breath when you lie flat. You're flat on the bed and then you're short of breath, you need to get up in a hurry. That is also one of the symptoms. Another one is, yes, you may not get short of breath when you lie flat. So you find people who would have slept for 2-3 hours and then they just wake up suddenly as if they are drowning. So they're extremely short of breath and then they have to sit up or go to a window or move, get outside to just get fresh air.
Mm.
And they need to sit down for some time before they can go back to sleep. That's also one of the symptoms. Of course, the two legs get swollen, or you find that you're always just coughing at night, particularly when you lie flat. You know, having some right-sided abdominal pain. Those are some of those symptoms that you will.
Right-sided abdominal pain, you said?
Yes, the upper abdomen
Okay.
for some reason.
Only right?
Yes, because of the structure that is there. So that may be some of the symptoms somebody who is developing heart failure may have. But it generally don't occur in isolation. So usually you have two or three or even all of them present in the same individual. So just having a right-sided abdominal pain does not mean heart failure if you do not have a shortness of breath, your legs are not swollen. So the reason for that abdominal pain then needs to be sought.
Okay.
If it's just an isolated abdominal pain.
Okay. So then, what can a person do to lessen their risks of heart failure?
Yes, I think that's a very important question because prevention, as they say, is better and cheaper than a cure.
I like this update on that.
Yes, so that's why it's important to identify. For you to be able to prevent heart failure, you need to identify the heart at risk.
Okay.
So there is a classification system that helps with that for you to identify if you have a risk of developing heart failure. That's when it's easy for you to prevent. So if you have high blood pressure,
Okay.
if you are diabetic, if you have cholesterol abnormalities,
Oh, wow.
if you're obese, if you are sedentary, or you have ischemic heart disease. Ischemic heart disease
What's
is
that?
like a junior brother of heart attack. Somebody's not had a heart attack yet, but has pain occasionally, not excruciating pain, that comes with exertion. So that's with exercise.
Is it located in
Yeah,
the
usually
heart?
centrally
Okay.
or on the left side,
Okay.
more centrally, sometimes on the left.
Oh.
So if you have that kind of pain, with exercise particularly or emotional situations, then yes, that will identify the individuals or alcoholics or smokers. That will identify the heart at risk. So if you know that, then you need to begin to look at these risk factors and see how you can get moving, you can exercise, you can treat your cholesterol, either with diet, and if that doesn't work, medications may come in, treat your diabetes very well, treat your blood pressure,
Mm.
Work on your weight, So that way you will be preventing heart failure.
Okay. Now, do remember you can join this conversation by sending your WhatsApp messages in to 0809 You can also take the conversation to Twitter. Use the hashtag SmoothHealth981. This message on WhatsApp comes in from Kweju, who says, "What about having increased heart rate? I'm guessing in rest mode when you're inactive." So that's part of what you had talked about. No, you talked about shortness of breath.
Shortness
So
of breath.
increased heart rate in when you're inactive.
That may be one of the features of heart failure, which should be a sign. That means usually it's a doctor or because you're using a device that will recognize that. But like I said, if that occurs in isolation, you do not have shortness of breath, you do not have cough at night, you don't have any difficulties lying flat,
Hmm.
feet are not swollen, that would not be indicative of heart failure.
Okay.
So you need to find out why you're having that, because there are other things like thyroid abnormalities. Some even just have that resting high heart rate
Hmm.
without any cause. So it is good to then find out. People are having fever, have that, people are just. So there's a few reasons why you may have that. But if it's in isolation, then it will not be indicative of heart failure, but then need to find out why that
Okay.
is so.
Okay. Well, we are streaming live. Do you remember up on youtube.com/smooth981 FM Lagos? You can also go to that platform to ask your questions or share your observations. All you need to do is leave a comment on that live stream. Well, it's in the little box that says say something, so you can say something there. All right, now, Dr. Adebayo, let's move on to treatments. So, what treatments options are available for heart failure?
Yes, there are treatment options, and that would then be based on whether the presentation is acute. What I mean is that there are some people who have developed heart failure slowly over some
Mm,
time, or they may even be on some form of treatment. There are people that come in very acutely. That means they fall suddenly sick and they come to the emergency room. For most of the patients who come to the emergency room or they come to the clinic, what we call diuretics, the water pill, it's one of the cornerstone of treatment. Because what it does is when the heart fails, there is congestion, a lot of fluids that the
build
heart is
up.
not able to move around quick enough,
Mm,
so the systems get flooded. So by giving injectables of that, it offers a lot of relief. So most patients with heart failure, many of them, not everybody, qualifies for that therapy. Of course, heart failure itself is actually currently it's divided into about three when you look at the kind of treatment you give. There is the heart failure that occurs just because the heart is not contracting well.
okay.
That means the contraction is really poor. So we call that heart failure with reduced ejection fraction. It's still saying that the contraction is not good enough. That's what that means. And then, of course, there is heart failure with a contraction that's just in between. It's neither severely reduced nor completely normal. And then you have people who develop heart failure even though the heart is contracting well.
Oh,
So where the evidence for treatment benefit is in most of the evidence you have is in when there is heart failure will reduce ejection fraction. That means the heart is not contracting well. There are four medications in that class that have survivor benefit, which can be used. I may not go into details here, but there are medications that are available.
okay.
But when you come in acutely, diuretics or water pills, injectables form a major part of that treatment in providing relief of symptoms when you come. Of course, there are other supportive treatment that are
Mm.
also given.
Okay, so diuretics, what does that treatment look like? For example, when and how should you use diuretics?
For many of the patients that come in acutely, at that initial presentation or worsening, they generally require diuretics. So when they come to the emergency room, injections are given
Hmm.
to make sure that the water load, the excess water load that's part of what is causing the symptom, is relieved. So they pass a lot of urine and then they feel better while you're also treating them in other ways. So that also tend to form part of the treatment for some weeks
Mhm.
after that. But after they are stabilized, usually the diuretics may be withdrawn.
So it's not something that should be long term.
It usually not long term,
Okay.
particularly for people that recover well.
Okay.
You know, you may not need it because he has not shown any survival benefit. It's useful acutely to relieve symptoms,
Mm.
but it's not been shown to prolong life or to improve the quality of life on the long term.
So basically, it's like a great intervention.
Yes,
Yeah.
at the acute stage
Okay.
of the illness.
Okay. So if we then move away from diuretics, what other medications would you advise a person? Would you advise one to take?
Okay, like I'll just mention the classes of medications. We
Mm.
have the what we call the angiotensin converting enzymes and the angiotensin receptor blockers, which are used. Then, of course, there are the beta blockers, which are also used. There are some other aldosterone antagonists. You know, that's the reason why I really
The
do not.
only I'm going to not I can't even hide this from you. The only thing I understood was beta blockers. Everything else,
Yeah,
you may have to
I
break it
guess
down for me.
beta blockers are common.
Yes.
Okay, the way to explain it is that in the current concept and understanding of heart failure,
Hmm.
it is known that a major part of what happens in heart failure are neurohormonal. That means it's not just the structural abnormality,
Hmm.
it's the hormones that are produced in the body that are supposed to be protective
Ah, okay.
that are really harmful.
Okay.
So many of these medications are then, given to counteract those neurohormones that are produced.
Ah,
Yes. So,
I'm
and that is
starting
why
to
the
understand
explanation will
now.
be a little bit
Yes.
complex to give.
Okay, but yes, now we're understanding. All right. So, at what stage or situation would you think it's important to adopt new treatments and procedures?
Usually, at every follow up, usually maybe initially after the acute presentation and discharge from hospital, the individual will be seen within a week or two, and by that time, you expect that they would have stabilized significantly. So, if you want about a month, 3 months, if there is no significant, if patient is still symptomatic, they still find that they have shortness of breath when they walk a little bit,
Hmm.
then of course this treatment strategy then need to be reviewed to look at what else can be added. There are other medications that may be added based on whether irregular beats are there, whether the heart rate is fast, like somebody was mentioning. If you've been on other medications and the heart rate is still fast, we may then bring in medications to reduce that. And of course, we also be look at whether supportive treatment will also be necessary. So at every visit, there is evaluation to see whether, because the goal of the treatment is to get the individual back to what they usually would do.
Pre-heart failure
Yes.
levels.
So
Yes.
if they are then not able to get there, that means they still have shortness of breath. They are still limited in what they do. You then need to begin to add on other kind of treatment to see whether they will benefit from that other kind of treatment.
Mm. And how long would a person with a heart failure patient need to take their medicine for?
The medications are virtually lifelong
No.
because usually by the time an individual develops heart failure, there has been some abnormalities of the heart which the medications will help to correct. So it's really like a lifelong kind of treatment, you know, that the individual needs to be on the medications. But sometimes some other interventions will need to come in. There are sometimes you need to use pacemakers. The first of that will be what we call in the defibrillator. They are implantable. That means they are actually implanted into
Mm.
the individual. And that will occur in those who develop heart failure. That's the recommendation is strong for those who develop heart failure in the setting of a heart attack. So
Okay.
for those ones, if the contraction of the heart is very poor, the risk of developing fatal irregular heartbeat is very high. So those ones get a pacemaker or a defibrillator, really.
Okay. So what's the procedure for that surgery like?
It's it's through the vein, and then the generator. That means the small size device
Mhm.
that gives the shock is then implanted under the skin somewhere in the chest.
Oh, wow.
So really, you may not even notice that they are carrying anything after the procedure. It's not a major procedure because it's done through the veins.
Mm.
Yes, so it's not a major procedure.
Would they be able to walk through those airport scanners?
Yeah, but they need to alert people. Of course, they
Okay.
are getting safer and safer now, but
Mm.
they need to have an alert that they are carrying
Okay.
pacemaker.
Okay. Without setting things off. Gotcha.
Mhm.
All right. And what would recovery look like, and how long would it take?
Yes, recovery will be trying to return the person to what they used to do.
Mm.
Being able to recover fully would depend on how early the diagnosis is made, and but that's why it's important that for those who have early symptoms, it's good to go to the hospital. If by the time your 1 kilometer drops to three quarter of that,
Mm.
you're more likely to have a complete recovery. But for those who wait until even
A
at
few
rest,
steps. Yeah.
they have shortness of breath, recovery may not be as good. Usually, a few months down the line, 3 months, 6 months, you expect that you should have a close to normal, close to full recovery.
Oh, wow.
Yeah.
Wonderful. Okay. Because sometimes when you think heart failure, it sounds, well, nobody wants anything going wrong with their hearts of all things. So it
Yeah.
can sound a
Because
little
they still need
daunting.
to be on those medications,
Mm,
on whatever devices.
yeah.
And of course, even though there's full recovery, but then prevention, like I said,
It's so
is
much better
better
than cure.
than cure.
Meanwhile, for the procedure, what's the downtime for that? Once they have the pacemaker put in, is that how long would it take for a patient to recover from
No,
that procedure?
that's
It's just instantaneous.
it's virtually instantaneous
Oh.
because, like I said, they're fairly minor procedures.
Mm.
So you're probably in hospital the next day or the day after. Sometimes they go home the same day.
Ah, oh,
Yeah.
okay, okay, okay. Now, what about rehabilitation? Is there any role for that?
Yes, there is rehabilitation because not everybody would recover. Not everybody will recover or recover completely. Some will have a lot of residual deficit. So rehabilitation is then to assess
Mm.
the cardiac status, the functional status of the individual, and then prescribe the kind of exercise they are able to do. And then of course that's where physiotherapy comes in. Some may need to change the kind of work they do.
Mm.
If you need to get a pacemaker because you've had if near fatal arrhythmia, of course nobody wants that such an individual to be a pilot or work at a height, those kind of things. So there's rehabilitation at work. There's also exercise rehabilitation.
Mm.
So it's a multidisciplinary thing. Sometimes dietitians have to come in, and then of course nurses, home visitors. So it is a continuous process of even just integrating them back fully into what they have been doing before. So there is a full range of things, possibilities there.
Okay, now, with the time we have left, let's take a moment to discuss aftercare. So, what lifestyle changes can one make to improve their heart health and also reduce the risks of having more heart failure, exacerbations, and hospitalizations?
Yes, top on the list of that is compliance.
Okay.
Compliance with the medications,
So, basically, take your medicine on time
yes,
as
and
prescribed.
regularly,
Yes.
because many of them will be on multiple medications,
Right.
and it can get very tiring after some time to be swallowing pills every day.
Mm.
So they then need to remember that what keeps them healthy is actually the medication, because for some of them the heart is bad already, and it's the medications that keep them on. So it is important to take the medications regularly. Exercise is important. A lot of times also salt intake would need to be reduced to some
Ah,
extent.
people, salt
Yeah,
intake. I hope we're listening.
you know. Sometimes they may need to take some vaccinations, the pneumococcal vaccines,
Okay.
Because for somebody who's had heart failure,
Mm.
yeah, anything like an infection may precipitate another failure.
Oh, oh, interesting. Okay.
Yeah, so they may need to get some vaccination. For those who take a generous quantity of alcohol, they may need to abstain or at least moderate that.
Yes, the generous will have to become stingy,
For
if
those
any.
who smoke, of course, they need to stop
Mm.
because there's really no advantage, there's no benefit anywhere. So those are some of the things that, and of course, keep their appointments, and also that's essentially what needs to be done so that there would not be exacerbation. That is, that's their own part of prevention of exacerbation.
Mm.
But like I mentioned before, prevention is always better because even for heart failure, even though they may get better and then return back to what they do, the mortality rate is still very high.
Oh.
Yep.
Right. So, back into the realm of prevention being better than cure and cheaper than cure. Um, can you just take us through those symptoms just one more time so that we can have it locked in our minds?
The symptoms for heart failure.
Yes.
Yes, I mentioned first of all that shortness of breath,
Mm.
because apart from heart failure, there are other reasons. For whatever reason it is worth investigating. If you find that you are doing a certain kind of exercise and you now get short of breath or you have to rest before you can finish that task, you may need to check that out. If you then find that lying flat is difficult because you get short of breath when you lie flat, or maybe when you sleep, you then wake up a few hours down the line because you cannot breathe well and you need to sit up or go to
No
get
wonder.
fresh air, sit down for some time. The
Mm.
legs are swollen, particularly the two legs.
Mm.
But even if one is swollen, it may not be heart failure, but you need to also check that out. So cough at night, you find that when you lie down, you start coughing. Not only at night, that when you lie down, you're coughing. It's almost the same thing as shortness of breath
Mm.
when,
Okay.
when, when you lie flat. You may also, along with some of the symptoms I mentioned, have some level of discomfort on the right side of the upper side of the abdomen. So if you have any of these, it's good to check that out. But of course, it's good to also remember the heart at risk
Okay.
because that's the level of prevention. If you have any of these, you know that you are at risk. If you have hypertension, you have a family history.
Mm.
So that means you need to watch your blood pressure more frequently. If you are diabetic, you have a family history, so you need to watch that and make sure you do not develop that. Do whatever you can to control your weight, to move. And then, of course, if you have cholesterol abnormalities, if you are sedentary, if you're overweight, a smoker, take a lot of alcohol. So all those identify the heart at risk, and then you need to work on them to
Okay.
prevent heart failure.
Okay. Ah, what an enlightening conversation. Thank you so much, Dr. Adebayo. I've been
Pleasure.
speaking with Dr. Adebayo, who's a consultant cardiologist and director of medicine at Iwosan Lagoon Hospitals. And from all your expertise and experience, thank you so much for taking us through what we should be on the lookout because we want tip top, wonderful, and healthy hearts. And so, if there's any sign or symptom of heart failure, get yourself to the doctor very quickly. If you like Dr. Adebayo and what he said, go ahead and find Dr. Adebayo. Thank you so much for joining me for today's Smooth Health. It really has been enlightening. And of course, everybody, if you just tuned in or you want to update yourselves or remind yourselves of what the conversation was about and the key points of the conversation on heart failure, then go over to youtube.com/smooth981 FM Lagos where you can catch the replay. All right, so Dr. Adebayo, I hope not to see you in the hospital because I've been good and taking care of my hearts.
Yeah, I hope so
All
too.
right, thank you so much. And that is coming up great music on the other side. At 7 p.m., it is going to be Total Football. I'll be back before then playing you good music right here on the Smooth Drive.
Health on the Drive
Uh,
every Thursday at 5:15
thank
p.m.
you.
Thank you.